I'm Cynthia Clipper-Gray. I'm the Injury Prevention Manager for Eisenhower Medical Center, and I'd like to welcome you to our presentation today on our safety management plan. First, a few introductions. Tim Berenger, who is the Safety Officer for Eisenhower Medical Center. He is also the Director of Safety, Security, and Emergency Management and Employee Health. Employee Health Services is also a part of our team. You will hear more about them later in the presentation. And Occupational Health Services, we have 2 occupational health clinics. The director of our clinic is Dr. William Christensen, and he is actually at Employee Health every Wednesday to see employees. Allied Universal Protection Services is our contracted security service. They're here to perform a variety of tasks, both manning our main entrance and our emergency room department, and also providing transportation for employees to and from the various parking lots around campus to the location where you work. Our safety management plan is focused all around our employees. So everything that happens here happens either by or for or to you. Our second layer is our environment, and the environment is literally what it says. It is everything that you touch, the air that you breathe, the temperature of the room, the lighting, all of the fixtures, the furniture, and including the flooring. Community is our third layer, and as a public health agency, we are required to be able to respond to our community needs in an emergency. Emergencies like earthquakes, annual fires, things of that nature. We're here to be able to provide what the community needs while still being able to maintain operations of the hospital. As we get into our plan, we're going to focus first on your safety. Safety is simple. Do what's right the right way at the right time. Unfortunately, I receive about 400 incident reports a year that say that didn't always happen that way. So we're going to examine through this process ways that we could help you to work safer. First, let's talk about our workplace ergonomics. Eisenhower is one of the top 100 technologically advanced hospitals, and as such, everybody here at some point in time works on a computer. So our computer ergonomics have become an increasingly important part of how we work through our day. We have a full-blown ergonomics program that can help to just make you more comfortable as you work. We can also address anyone that's had any prior injuries or anyone with a disability. Our program is designed to make your workplace flex to you so you don't have to flex to it. Our safe patient handling program also helps us to be able to lift and move patients more safely so that employees don't have to maintain awkward positions, and patients can feel safe when they're being moved either from their bed to a gurney or from their bed to a chair or a wheelchair. Equally safe is our program for materials handling. The basics of bend with your legs, not with your back. You always want to be able to have materials closer to you when you're lifting them. And before you go to pick up something heavy, remember, it doesn't have to be large in order to be heavy. You always want to test the weight of the item by trying to move it with your foot. If you can move it fairly easily, then you can probably lift it. The lifting requirement is anything that you're going to be lifting regularly, you want to keep to 35 pounds or less. Anything that you're going to be moving occasionally can be up to 50 pounds, but you always have to check yourself and know your own ability. If you feel like you need help, please ask for it. Blood and body fluid exposures. Everyone in the organization has the opportunity to be exposed to blood and body fluids. You always want to assess the situation before you perform the task. Inform the patient of your expectations, such as, please don't move even after I remove the needle. Ensure that safety precautions have been implemented. Make sure that you set up your site before you ever start to work. You have everything you need right there, easy to reach. You always want to make sure you wear the appropriate PPE. If you need to have goggles or face shield, we always have those available for you. If you need gloves, a gown, whatever it is, these items are always available in your workspace. And after you're done, be sure to always carefully engage the safety tip on the needle and dispose of the items in the sharps container. Preventing slips, trips, and falls. Our entire property here is approximately 142 acres. Most of that area does actually provide space for Eisenhower employees to work. In the course of navigating their space throughout the day, whether it's inside the buildings or through the parking lots, down the sidewalks, we always want to make sure that we're taking great care to watch where we step. You know where you're going, but you need to watch where you step, because it's those hazards that are directly in front of you that go unseen and eventually cause people to slip, trip, or fall. Next, we'll talk about our injury prevention plan. Every business with more than 20 employees in California is required to have an injury and illness prevention plan. This plan is required by law. It's located on ICNET in Lucy Dock for anyone that wants to review it. It provides safety and health training and instruction, and it makes sure that when we conduct our root cause investigations and our documentation, looks for the cause of the accident and not to place blame on the persons involved. To report an occupational incident, you want to inform your supervisor immediately. You then want to report the incident as soon as it happens or within 24 hours by completing an employee report of occupational incident, the EROI. This can be found on ICNET. If you intend to seek medical attention, you want to print a copy of it, have your supervisor sign it, and take it with you to either employee health during regular business hours or the emergency department if it's after hours or on the weekend. We do not provide occupational health services through our urgent cares or our occupational health clinics for Eisenhower employees. After you receive care, it is the employee's responsibility to report back to the supervisor what the outcome of your visit was. If the doctor has given you time off, you need to notify your supervisor. The next business day, after you have been seen in the emergency room, you want to contact employee health so that you can be followed up. They are your primary care post-emergency care visits for all employee incidents. Just a little note, not all incidents are qualified as injuries. Not all injuries qualify for workers' compensation benefits. What do we mean by that? Not all incidents are injuries. Some things that don't require more than 2 visits to be taken care of are considered first aid. Not all injuries will qualify for workers' compensation because workers' compensation is mostly to compensate you for any time lost from work and also to compensate you for any permanent disability you may suffer as a result of the incident that occurred. If neither of those 2 things exist, then a workers' compensation claim isn't necessary. Some basic notes and behaviors that we want you to implement so that you can work safely throughout your day. Work in the moment, stay focused on the task at hand. Essentially what that means is you don't want to be thinking about the next thing that you're supposed to do while you're currently doing something. You don't think about the next patient you have to go and start an IV on while you're currently trying to start an IV on another patient. That's how incidents and accidents occur. Don't put yourself in the path of danger. Pay attention to your surroundings. Don't walk and text on your phone or talk on the phone or email on the phone while you're walking, because that makes you distracted from your environment. You want to use handrails when you're walking on stairs and wet surfaces. You want to not run in the hallways. Sometimes in emergencies like a code, there may be a necessity for you to walk quickly, but you don't want to run. You don't know and you can't see who's coming out of the rooms as you're running down the hallway, and you always want to be mindful that you are not the only one using that as a passageway. You want to discuss unsafe work practices with your supervisor or director upon noticing them, not after you've gotten hurt. The reason why you want to talk to your supervisor and director first is because they're going to be able to explain to you better why we use the tools that we do and why we have the procedures that we do. They're also the people that are most likely to be able to implement any improvements if your idea seems like it may work better. If you have any issues with any safety items around the campus, either in your physical environment or in your department, you can email me at employeesafety@eisenhowerhealth.org. Now, it is going to tell me who you are, so if you would like to remain anonymous, just write that in the email and I will get back to you personally. Employee Health Services. As I mentioned before, Employee Health Services performs many different types of services for Eisenhower employees. Vaccinations and flu shots during flu season, annual MASFIT and TB surveillance, first aid services, and our injury medical management if you do happen to suffer an injury here. Let's talk a little bit about the annual MASFIT and TB surveillance. Now, those things have to be done every year. MASFIT testing is usually done close to when our annual benefits open enrollment period is. That may change a little bit as the year goes on, but TB surveillance, TB testing is due within 30 days of your annual date of hire. Every year, you have a responsibility to either identify your TB ambassador in your area or contact Employee Health for the days that are best for you to go over and have your TB taken, but also to have your PPD read. And it's a time-sensitive thing, so if you don't keep the timing, then you will have to repeat it. Also, our third-party administrator for workers' compensation is Athens Administrators. Claim forms are available to you through Employee Health. They would be provided if your issue is determined to be compensated from workers' compensation. Now, the environments of care. The environments of care are a list of standards that have been established by the Joint Commission. We are required to maintain a certain standard within our environment to ensure that we are taking care of not only our patients, but also our employees, visitors, and physicians by operating the facility as we do. Some of the things that we are required to make sure we inform you of is emergency communications, medical device and medical gases, electrical safety, hazardous material spills, safety data sheets, your right to know, radiation safety, and biohazardous waste management. First of all, our safety communications. Our phone systems are completely digital, with the exception of about 47 red phones that we have around the campus. These red phones are old analog phones. They're low energy, therefore, they are not lost to service if we should lose power here on campus. That would impact our digital services. Next to every red phone is a directory. That directory has every extension for every other red phone here on the campus. So in an emergency, should you be stranded in an area, you always want to look for the red phone if the digital phone system is down. You can call the operator. You can also, if external services are still working, you can call outside of the hospital by dialing #1 area code and the number you are trying to reach. Medical device failure. Medical devices, we have probably 12,000 medical devices to be able to accommodate all of the patients that we have throughout the health system. Anytime someone goes to use a medical device, you want to check it to make sure it's operational. Once you plug it in, if it's an electronic device, you want to make sure the lights come on and that everything is functioning properly. If it is not, We don't hit it, we don't kick it, we don't spin it around 3 times. We tag it and we pull it out of service. You call 8563 to have a maintenance technician come and pick up the equipment. They will either be able to repair it or we will replace it. We don't write on the equipment. We have tags available on every unit. So you want to write on the tag what's wrong with it, your name, and your extension in case they have any problems trying to recreate the issue. Medical gases. Medical gases refer to any of the gases that are coming out of the walls through the nasal cannulas. The medical gases on every unit has a main shutoff. That main shutoff for the Annenberg Pavilion is in the nurses' station. In the East Tower, they're located near the stairwells. Upon reaching your units, you should be shown and have it explained to you how the medical gas main shutoffs work. As an employee, your primary responsibility would be, if we have to evacuate a floor, you want to make sure that you're evacuating the patients and moving those that require oxygen to a portable oxygen tank. And if, for whatever reason, you happen to be the last person on the floor, and only when there is a threat of explosion or fire, would the medical main gas valves be turned off. Basics on electricity. We never use equipment missing the 3rd prong. The 3rd prong is the ground, and that is important to maintain the safety operations of the equipment. You want to contact maintenance at 8563 to inspect non-hospital issued equipment and extension cords. Every day we get about 30 to 50 patients in from home, from board and cares, from skilled nursing facilities, or other locations, and sometimes they may bring in their own equipment. We need to make sure that equipment is in safe working order before it gets plugged in and becomes a fire hazard. You always want to use the head of the plug to plug in your equipment, not to pull or yank on the cord. This damages the head of the plug and can also damage the wall outlet. Hazardous chemical spills. These are referred to as a code orange. And safety and security goes over all of our emergency codes, but I address this one specifically because this one tends to affect people the most directly. Symptoms are a noxious smell or odor, burning or itching eyes and or throat, feeling dizzy or feeling nauseous. If these things should happen and you're working in your normal work environment, do not go and look for the source. Check with your employees directly working around you and others in the location or the building. Find out if anybody else is suffering from the same thing. If so, then you want to exit the area immediately. Go to a phone and call extension 44. Extension 44 is our emergency line to PBX. PBX will want to know who you are, where you are, and if you know what the problem is. If it's something that's in the air, whether you can see it or not, you want to tell them it's a code orange. There's some type of chemical spill that is affecting the people in the area. They will then call the safety officer. They will call the director of EVS, who's our on-site materials management officer. They will also call security. Therefore, being able to leave the area and go and seek any medical attention, which would be normally at employee health, depending upon your symptoms at the time. But it would also help security to know exactly which departments or which buildings are affected so that they can ensure that all of the patients are removed, as well as that no one else goes in, so we can call emergency service to do what is necessary to be done. Hazardous Material Safety Data Sheets, or SDS. These are included under the OSHA requirements for your right to know, the right to know what chemicals and substances that you are working around in your direct area. The safety data sheet must be located in the work area. For Eisenhower, ours is located online. It's on ICNET under Web Services, and it's called Web Services Binder View MSDS. You can go there and put in the name of any product, any material, and it will tell you from the manufacturer, most importantly, how to prevent injury to yourself while using or working near the product, what type of first aid or medical treatment is necessary if you should have an accident, and it tells the active ingredients in that product so that if you have a known allergy or known sensitivity to something, you would know exactly what's in that product that's causing you to have problems. We use the safety data sheets mostly in employee health when employees do report with interactions to certain things that they're working with, from gloves to lotions to soaps and all sorts of things. Radiation safety. Exposure prevention is primarily when you see the radiation sign posted to enter the area. You have to look for someone who works in the area and ensure that that person knows exactly what it is that you want to do before you are allowed to enter. There are two types of radiation exposures that can occur. Those are from diagnostics. We have a number of diagnostic tests here that we perform, and also for treatment, which if you ever have to work around patients or be with patients that are having either diagnostic or treatment services using radiation, you always want to limit the amount of time that you spend with a radiated patient, increase your distance from the patient, and if you don't have the ability to do either of those two, you want to make sure you are wearing the proper shielding. We have shielding for everything head to toe, depending upon what area that you are working in and how long you need to be in the patient's presence. For those of you that have to work around patients with radiation all the time, you would be issued a dosimeter. A dosimeter is a small plastic little box with a slight piece of paper in it. The dosimeter is to be worn on either side of your collar of your neck or your scrubs or lab coat. The reason for this is it's designed specifically to measure the amount of radiation to your thyroid. It's not going to be effective if it's kept in your coat pocket, on your shoelaces, in your scrubs, or on the dash of your car. These have to be turned in every 30 days, and the readings are posted in the department, so at all times, if there were a radiation overexposure, you would be able to see it, and it's managed and measured on an annual basis. Biohazardous materials. We have tons of biohazardous materials that we have to dispose of on a monthly basis here. Any area that's displaying the danger biohazard infectious waste sign, you want to stay away from there unless you have a designated functional reason for being in those areas. For our biohazardous waste, everything that we use in a patient's room, in the lab, in every diagnostic area here in the hospital has a biohazardous waste instruction program. Now, depending upon the color of the bin that you would dispose of your waste products in, Sharps containers here are mostly beige. What determines what goes in that Sharps container is the top. The top is a different color, and for every color, specific things go in those specific bins. There's only two bins that are a different color, and that's the black bin, which is for pharmaceuticals, and the yellow bin, which is for chemo products. Those bins are located in the areas where there would need to be a disposal of pharmaceuticals or chemodialysis materials. Infection prevention goes into this in a much greater detail in terms of what types of products you use and how they would be disposed of on a daily basis. So we will end our discussion here for biohazardous materials. Last but not least, emergency preparedness. Eisenhower has developed an emergency preparedness program. That program follows the guidelines of the HICS program, which is national. It stands for Hospital Incident Command System. When we have an emergency, we have the ability to pull this program into action. It can be any type of emergency, such as a hospital fire or a child abduction, an explosion, natural disaster, or since 9/11, bioterrorism and hazmat events. These types of events require us to have a full-blown decontamination team that's fully trained to put up our tent and be able to decontaminate thousands of people from the community if need be, if an event were to happen. The main objectives of the plan are to allow us to be able to maintain the safety of our patients in-house and the staff that are there to take care of them. Secondly, it allows us to use the rest of the property and the buildings to manage and triage and treat a large number of community members. And it also helps us to work effectively with Riverside County and California statewide emergency operations systems during a catastrophic event. It's a very coordinated, computerized program that allows us to stay in constant communication with the other hospitals here in the Coachella Valley, also with the county and any other hospital in Riverside County. We have several code triages that we use. Code triage standby. Standby we use on a monthly basis. We primarily use it currently to test our radio systems. We have 3 900 megahertz satellite telephones that we use to make sure that at all times they are operational, because that is our last stand communication from here to the county offices in Riverside. Code Triage Activate. We operate the Code Triage Activate twice a year as a drill. We are required to do 2 drills a year so that we are ensuring that everybody here knows what to do in the event of the emergency, and more importantly, what their role may be during that emergency. Most people are recommended to shelter in place, which basically means during the time of the active drill, you are to stay in place. You're not to leave your building even and try and conduct whatever business that you can in the confines of your own department. Any extra personnel not engaged in patient care would be requested to report to Cafe 34, which would be seen as our labor pool. Labor pool is designed basically to aid any area that is engaged in providing patient care with additional staff, be it clinical or non-clinical, to perform a variety of tasks that cannot be done completely based on the number of patients or people we may have to be dealing with at the time. Live Process is our software-based emergency notification system. Live Process came into being back in 2011, and we use it here to communicate a variety of emergency systems and issues that may be happening here on campus. When you are, I'm going to say registered, but when you come on to Eisenhower as an employee, you are automatically entered into the Live Process system. In the event of an emergency, you would be notified on whatever device that you provided the system as your main contact information. You may receive an email, you may receive a phone call at your desk phone, you may also receive a page or a call on your cell phone. It will provide a number. That number is designed for you to contact to find out exactly what the emergency is and what you are expected to do if you are here, not here at work. If you are here at work, you may be in a separate building, and if the guidance is for you to shelter in place, you are expected to follow that information. In an emergency, the campus can become inundated with thousands of members from the community because the hospital represents a place of safety. The last thing that we want to do is put any staff not directly involved in the event in harm's way. Sheltering in place is not to keep you in an area where you cannot leave, where you cannot be safe, but to basically ensure your safety. We need to know where everybody is at the time of an emergency so that we know exactly what's going on with the campus proper.
People keep falling, stepping in the river rocks, looking for a shorter way. If I told you once, I told you twice, you don't hear what I say. You ain't seen nothing till you've been hurt, falling, then you're sure to be a change in your ways. Just a little liquid that causes a fall, that started with a little spill like this. Walking down the stairs, not looking where you're going, feet flying up in the air. Saying no signs, no for wet floor sign in the middle. Kept walking like I didn't care. So I took a big chance at the stairwell entrance as the housekeeper went me away. Wasn't me she was fooling, cause she knew what she was doing when she told me not to walk this way. She told me to not that way. Not that way. Not that way. Walk this way. Not that way. Told me to not that way, not that way, not that way, walk this way, not that way.
Thank you for coming to my presentation today, and I hope that you will work safely everything that you do, and if you aren't able to avoid incidents, we are here to take care of you.